Okay.
And Steve, turn on the captions, please.
Oh, yeah, sorry. Okay, where's the captions on here? Oh, captions, there we go. Well,
Not a big deal. I didn't think it would be a stumper, though.
it should be easy. Show caption, there we go. Now we're talking. Okay. Now we can get going. Okay, so first of all, I have to look and see who's online today. Who's new? Do we have anybody new on the call today? I don't think so. Okay. So we don't need to do that. And so just a reminder that after our meeting, for those who are interested, that we do our kibitzing with colleagues. And as you all know, it's a very informal kind of thing. We may have 2 people, we may have 10, it may last for 5 minutes, it may last for an hour. So you're all invited to participate. So anybody join us that's new today? Okay, so moving on. I want to first of all, as always, thank our sponsors, Care First Health Plan, Valley of the Sun United Way, Satellite Broadcasting and Communications Association, Khajiit Triad Wireless, and Karen Ziegler Consulting Services. So we thank all of you. And moving on, excuse me. So the agenda, we have kind of a full agenda for today. It's kind of evolved interestingly. And in terms of updates, BEAD and digital inclusion, Sandeep, I know, has a conflict. I haven't seen Nicole. Are you online? I think she's traveling today. And Alicia with the Digital Equity Institute is ill, so she's not going to be here today. And Cindy is also out of the country, I believe. So we're not going to get those updates today. But I did want to say that I just talked with Sandeep just a little while ago and told him that I would like for us to schedule a meeting with him and maybe Cindy and Aaron and whoever else for us to get a better understanding about where they are with their planning, because I'm in the process of updating our sponsorship package and I want to understand where they are, where they're going, and where we intersect with them so that we're all in sync with them and collaborating. So hopefully we'll be able to do that in the next week or so. Poor Sandeep is still overwhelmed with so many things going on. But anyway, but we continue for a good relationship with Sandeep, and we'll try to figure out how we best intersect with all their BEAD and digital equity planning.
And Steve, Mark,
Yeah,
here,
Mark.
just to mention that I had been in discussions with Brian Sherman and Sandeep for a couple of months, and Sandeep has joined the ATIC board at our last board meeting.
Yep. Thank you, Mark. Next thing, just moving on quickly, I think most of you knew that NTIA had been having listening sessions for, I think, the last 4 or 5 weeks, and they're now done with those. If you wanted to provide any input, today is the deadline. And I don't know if anybody was on that call that wants to, was on any of those calls that wants to share any comments. Yes, not.
Oh, I was just unmuting. Mikhail Sundust had some really great comments in the session that I was listening in on from the tribal perspective. So that will be well represented, hopefully.
Yeah, actually, it was interesting. I didn't join until late, and just as I joined, Sandust was Mikhail was speaking, so he's on our agenda today, so he might have something that he wants to add. So moving on, Aaron and excuse me, you guys have anything that you want to add about what's happening with the ACP sign up? Aaron and Mauricio?
I'm still in a holding pattern for the print materials, working with other people on Lyle's team now. Thank you, Lyle, for giving me to the right people there. So we're working through the last details on that. And then just as a reminder, the State Library has an upcoming webinar geared towards library staff across the state who might end up with questions about the access and kids care benefit changes and things like that around the continuous enrollment changes. That is scheduled for the end of this month on 5:30 at 1 p.m. And it is, for it's going to be geared towards people getting questions at, a public service desk kind of situation. So it'll be pretty top level, sharing some of the resources that are available on the various websites. And that is my note on that one.
Okay. So Mauricio, I haven't seen you in a while. Do you have anything that you want to add or comments?
No, we've been busy. Actually April 1st was when Access started disenrolling folks from coverage for Medicaid here in Arizona. I know that the May date is for more like a federal date, but in Arizona, they started disenrolling members April 1st. So as you mentioned, I've been very busy traveling throughout Northern Arizona, just sharing information about the changes, providing materials, education to make sure that Arizonans do not lose their coverage. So that's been the main focus right now. To make sure that folks that have their medical coverage that get to keep it. And whenever we do that, we also provide information about ACP with different flyers, information. We send them to the websites. And we've actually been just educating people about ACP. You still have a lot of people that have never heard about it, which it might be surprising to some of us, but being out in the community, there's still a lot of people that don't even know that it exists or that it's available. So education is a big part.
Yeah, great. Thanks, Mauricio.
I have a comment about the ACP stuff. How are you coordinating with others to understand how much lack of computers and digital literacy skills affect ACP enrollments?
So I can speak to that a little bit with the digital navigator programs that the State Library and also the Digital Equity Institute have. That's kind of been one of the ways to combat that, if you will. And so one of the things that we were working with Lyle's team before that print material came out was on connecting them to those local resources here in Arizona that anyone across the entire state can call, either of the organizations who provide those digital navigators. So the ones through the Digital Equity Institute, and I'm sure Elena has much more about this to say as well. I just saw you pop up in the chat. But that is purely ACP focused, but the Connect Arizona digital navigators provide kind of a wraparound digital literacy training through one-on-one appointments, troubleshooting tech issues. We have access to North Star, which is a really great educational platform that people can work through on their own or with one of our navigators kind of helping them through it. So yes, but obviously there's room for more on all of that. I'm also evaluating the Arizona Career Readiness Certificate through OEO as a possible way for me to get trained to be a trainer, to take that information out to the libraries. Now, of course, that's a workforce development bent on digital literacy, but definitely, you know, again, wrapping around, right? And kind of taking it from all those different angles.
Yeah, I understand, Aaron, that the navigators provide information about those things, but I'm just really wondering if there's really a bottleneck in enrolling people on ACP. If people don't have computers, don't have digital literacy skills, how can they enroll in ACP if they in internet service if they don't have those things?
Just this, Lyle, sorry to interrupt and bogart your meeting.
No, Lyle, that was a perfect segue for you.
Oh, really? Really quickly.
You want to introduce
Aaron?
yourself real quickly, Lyle?
Lyle Lashida from the Federal Communications Commission, serve as chief of the Consumer Affairs and Outreach Division, working with a bunch of great Arizonans. Aaron, I wish I could just clone you and then I wouldn't have to work. Actually, I could retire and put you into different states, and I would love to retire. ACP in and of itself, depending on the local ISP providers, is also an equipment provision program, right? We maybe need to do a little more here at the FCC to stress the $100 discount that comes toward a laptop, desktop, or tablet for successful ACP applicants themselves. And so, you know, most people have opted for the tablet as just informational only. But, you know, so when at least the FCC, when we're in town, we do enrollments. We bring our own computers for consumers who do not have a computer. So we don't want them to get caught in the catch-22. How do I apply with a computer when I don't have a computer? So we bring our own laptops and we find different places. And then we recommend that once they are accepted for ACP, take a look at the Companies Near Me tool, and then which has identified within a zip code, house a zip code, those carriers who are offering the equipment discount program as a means for them to procure not just the discounted broadband, but also the hardware. And then separately,
Is this computer, you provide a discount, right? It's $100.
$100 off. And
But does that provide I mean, if how much is a computer with basic software? I mean, can they afford these things? And
so it depends. And again, like I think the number last time I checked was 95% of folks are going with tablets. And tablets probably because it's pricing, right? Tablets run, if you take a look at it's not going to be, might not be an iPad Air, but it'll be a tablet. So it would run where I think the $100 discount would take most of it off. But
the tablets, do they have software on them like Microsoft Office or?
They'll have some equivalent for 100.
Right, exactly right. There'll be something like it. Might not be Office, but whatever the operating system is, it'll be tuned to the operating system, and that varies by provider.
So do you think you understand the bottleneck there with people having computers and digital literacy skills, about whether that's really going to limit the ACP enrollments?
So my personal experience is not necessarily the experience of every consumer, because I see consumers as they come in to enroll with or without a computer, with or without computer skills. Often they come into our enrollment. We did a whole bunch of them last week in South Carolina without an email address. So we signed them up for a Gmail address and just sort of do the really basics things and encourage them to hook up with their grandchildren or whatever. But I only see people as they come in wanting to sign up. I don't get to see the people who don't come in, so I don't have a real good you know, I don't get to see all 50 million Americans. I'm not quite sure I'm the guy to be able to tell you.
Okay, I just think that to really understand where ACP can go, it seems to me there's a lot of coordination that needs to go on the, the device and the digital literacy skills training part of it. And I've never been very clear on how well that's coordinated and if that's going to limit how much ACP enrollment you can have. Like maybe a lot of the people who are enrolling in ACP, I've heard, are people who already have internet access.
Yes.
Getting subsidies
Yes.
on top of that because they already have computers, digital literacy skills, have internet access. They're getting subsidies because they're low income for internet service. But the issue of getting over this hump of people having the skills and the devices to really use the internet service, I don't know if that's really being addressed properly at this point.
I think these are two different, these are two different things we're talking about, right? For the FCC and Congress passing ACP, it is attacking the affordability for affordability hurdle for people who are low income, right? So affordability is one of the primary hurdles for people either adopting or maintaining broadband, and so that takes care of that thing. The folks who need more digital literacy, that's a multifaceted, multi-stakeholder issue that I don't know if there's one single or even multiple gurus that have a really specific lane only for that, because there's talks about you have to have a discussion about relevance to doubtful consumers, and you got to have maybe for people who may not adopt, there might be language issues or cultural issues, et cetera, et cetera. And so there have to be so many different stakeholders to be effective for that. I think that probably requires a broader discussion, some of which does not fall into a regulatory regime for a federal independent regulatory agency, which is us.
Well, that's being addressed in a lot of different ways, and we have a number of organizations who are on this call today and part of this task force, and in Arizona, who are doing a lot of work with ACP and getting people signed up and supporting them and so forth.
Yeah, I would like to see a clearer explanation of, are these ACP signups, are you signing up people that already have internet service and they're just getting discounts? Or are you getting over this hump of people not having devices and digital literacy skills to be able to sign up for internet service? I think that needs to be understood a lot better than what I hear.
Yeah, so in my experience, because we do a bunch of enrollment things, maybe about 70-30, between 70-30 and 60-40. The higher number being people who are low income folks who need the affordability boost to maintain their broadband. And I mean, I don't want to read into the discussion, and Aaron, I'm going to shut up now because I'm talking too much, but real quickly, I don't want to minimize the importance of people with broadband who are now getting a discount because they qualify for the program.
So are you saying, Lyle, that you think it's 70% of the people that sign up for ACP already have internet service?
That is not what I'm saying. I'm saying in my experience, my limited experience in doing ACP enrollment things, we're hitting between 60 and 70% of people who have broadband. And again, so I just want to really make this clear. That's great to me. Right, the program is written by the wisdom of Congress and instituted for people of low income to be able to afford broadband. So that's exactly where it should be, right? There are others who don't have it that we should still attack there, but we should not minimize the importance of helping low income people maintain broadband a lot of people. Okay, so if I'm really screwing up, Aaron and Elena, please shut me up now. But I really do, am passionate about this, of making sure that people who have broadband but are low income, we don't minimize the importance of them getting the ACP benefit, because it's still critical in my opinion. And with that, I'm just gonna shut up now. Sorry about that. And I'm sorry to bogart this meeting. Apologies.
No problem, Lyle. We need to actually move on, but we have a couple of, are there other kinds of updates that you want to provide, Lyle? And that the chairwoman is going to be in Phoenix, and maybe Elena, you also want to add to that. But Lyle, what is it? What's the plan there? And
So the plan is that the chairwoman's gonna have a press conference with the mayor on the 9th. I think they have tentatively identified a library to hold the press conference, and at the press conference, we generally either conduct a train-the-trainer session, or so that we can be Johnny or Jamie Appleseed for the community, or do an ACP enrollment session. We're going to let the Phoenicians decide what they want us to do. I know that there's been a lot of movement, whole lot of movement down among members of this group and others who are working like in the libraries, right? Etc. So there's already work going, and we were talking a bunch when we were first originally going to come out of the Arizonans or Phoenicians, one of the two, announcing a day of action or a week of action. If so, my message to the Elenas of the world is, since you're connected also to the mayor's office, we're going to have a meeting tomorrow. If you want to do that, right, just do it from the podium. Just let the mayor know and kind of back channel me, so that we can coordinate the mayor and the chairwoman's messaging. And then if you want to do a day of action, a week of action, and if me and my team can help on the ground, happy to help. If you guys got it, no harm, no foul, right? No insult, but I just want to be of service. But I just want to let you know that that's going to happen. And this is part of a chairwoman's program. She's gone to Boston, to Los Angeles, to Phoenix, and a number of cities are in the queue now to hold press conferences with mayors to talk up ACP as an important program for digital equity. So that's sort of the program on the night. And I apologize to Elena and Laura for just talking too much.
No, I was just gonna add, Lyle, one of the goals for the city of Phoenix is they want to have folks there that can be trained by Lyle's navigators. So that's largely the goal after the press conference, is to do like a workshop where navigators will be trained so that they can assist with signups. The city of Phoenix plans to hire, they haven't hired yet, but they plan to hire three people. They were one of the FCC ACP outreach grantees. And so with that money, the goal is to have these navigators participate in different, or with different agencies within the city of Phoenix. So for example, Youth and Family Services, or HUD, or the housing agency, or any of those kinds of organizations that are already having and bringing people together. And this will be an addition to, them helping them with other things. So like, oh, and by the way, we can help you sign up for the Affordable Connectivity Program, and then sit them down and, either explain to them what documents they're going to need. They may have to come back the following week. The goal is to have like a weekly, or even somebody every day at a different department within the city, so that the community knows, oh, if I want to go sign up for ACP, I can go, to this address at this time.
Yeah, I have a call at 3:30, so I have 3 minutes. Shoot.
Please,
Okay,
please
call me
mute.
later, because it's like, call me later.
What is it?
Shruti, can you mute?
And I'm like so stressed. I'm about to cry, and I
Uh-oh.
just need.
Okay,
Just call me when you have a
I'm
moment.
trying to
okay,
find
I'll
it.
be done with this call
Okay.
and I'll call you. Okay, bye.
Thanks, love you, bye.
Okay, well, anyway, so that's the city's goal, is to send their navigators out into the community to help it within various city agencies, as well as hosting events. And then Common Sense is going to be working with the city and doing school outreach and a few other things that we haven't nailed down yet. But yeah, so that's the plan.
In
And I
the,
think they chose Burton Bar.
yes, they
library.
did. So you read my mind. So in the chat, there's a question. Burton Bar Library at 10 o'clock on the 9th.
Okay. Yeah, so if you want, Lyle, we can send the information out to the task force. If you want more people there.
I gotta talk to the press officer, right? So let me have this planning meeting between the press officer and the mayor's office tomorrow, and then if necessary, Steve, I'll get it to you.
Yeah, and if you decide you want us to do that, please send me what you want, because I don't want to make up the words.
Roger that. We'll get you a forwardable thing.
I try to be careful about making announcements for other people. Okay, anything else, Lyle?
Just really, I shop by every once in a while. I just want to commend the entire state of Arizona, if you all are representative of it, in terms of working on digital equity and ACP, because you all are a forward-thinking, forward-leaning group. And I don't know if you know, compared to other states, but I get to see them, how good you all are. So after you log off tonight, or when you have happy hour, you should raise a glass to all of yourselves, because you all are doing great work.
Well, thank you, Lyle, and we appreciate your collaboration with us whenever you can make it. We're always glad to see you. Okay. We're ready to move on here. Just a second. So Janet, if we can postpone you for just a minute and to get to Mikhail first, and then come back to you, is that okay?
Of course.
Okay. So Mikhail, hold on one second here. Sorry about that. I'm pleased to welcome Mikhail Sundust, who's the executive director with the Gila River Telecommunications Digital Connect Initiative. We heard from him some time ago and haven't seen him in a while. But what prompted me to reach out to him is that they have issued an RFQ they're working on a digital equity plan. And I thought it was very unique, particularly because I think they're a really good example of how a broadband provider can really be engaged in digital equity, digital inclusion. So with that, Sundust, are you there? Mikhail, are you there? Mikhail, are you still with us? Hello? Oh, maybe he had to drop off. Okay, well, hopefully he'll be back and we'll be able to hear from him. So in the meantime, Janet, let's jump on with you, and it's great to see you. I haven't seen you a lot recently. I know you're very busy, and I know you've also been sick for a while, but you were, as always, doing amazing stuff, and it'd be good to hear from you. But I also want to, I think on behalf of everybody here, to congratulate you for
Thank you.
being a fellow with the American Telemedicine Association. So you might want to talk a little bit about that also.
I'm a fellow. Who knew? Actually, it's one of those lifetime achievement awards. It's really amazing. I'm so honored, and it's been a wonderful career for me for 25 years to be involved in the American Telemedicine Association, the United States Distance Learning Association, all of the groups here in Arizona that we've networked with in distance learning and telehealth and telemedicine. It's great. I mean, it's really great. I couldn't ask for a better award. Well, can I go ahead and thank you everyone so much. Can I go ahead and share, Steve?
You
Because I want
bet.
to rip through some slides.
You bet.
And I
start
do
sharing.
have other people's resources I'm sharing. Because there's so much going on, and there are things that you might not have heard about, and I'm going to send the PDF and make you dizzy while I do this, but I've got to be able to use my notes. They don't call it a BS degree for nothing, right? Duplicate my slideshow. Okay, here we go. So, as you know, our group is a part of the consortium of the National Telehealth Resource Centers, all those beautiful copper-colored states. So our program, when we were 10 years old, started getting this federal grant, this HRSA grant, to promote telemedicine and telehealth to the 5 Western states. And there's great strength then by networking amongst each of those consortiums, each one of those groups. And this has worked very successful for other HRSA projects like the Telegenetics Collaborative. But for us, the Telehealth Resource Centers are the folks who are supporting projects like telehealth and libraries, the people who have a lot of experience in incorporating telehealth technology in rural areas. So there's those resources for you. But a couple of the most recent things that we've produced, the Northwest Regional Telehealth Resource Center just produced this beautiful 1 to 2 hour learning module that's telehealth for digital navigators. Now, it's interesting that, you know, there's so much happening in the world with regards to training, and especially in Arizona. I mean, we're groundbreaking this place in Arizona. We're really doing national work here in Arizona with the training of our digital health navigators and preparing people for the public health emergency ending and for the insurance transition. So I want to share with you a lot of the work people have been doing. Meanwhile, our program are also working with the National Consortium to start a digital health navigator repository. So far, this is just a place where I've been dumping stuff, but it will be beautiful one day, and it will be a product of people who are working in the digital health navigator space nationally, and I look forward to helping build that. One of the other really fantastic resources that's just now coming to Arizona is this TAP map, a resource map of telehealth access points. So a mapping program was developed, and now by interviewing sites with just very minimal information, they've mapped these Northwestern sites, and we've just started getting started in Arizona. But what you can do is, I was, for instance, looking at a location, if I was to travel, how I could get connected to telehealth resources. And this map is already populating other states, but I'm pretty excited, of course, for Arizona. You could actually find, if you're looking for integrative medicine, if you're looking for an urgent care center, if you're looking for a primary care provider, you can easily, through this asset map, locate those things, which is amazing and a great complement to our service provider directory. So if you do want to, in whatever state you live, find a telegenetic counselor, find someone who's doing teledermatology. And we get asked this stuff all the time. We'd never tell people what to buy, what services to use. But this is a group of people, over 200 companies, that have completed a 30-page survey on who their clients are, what their business model is, all the information that you would need to be sure it's a legitimate company. So to be able to make these really easy to access resource means that, of course, we're making access to things like nephrology and telegenetics much more widely acceptable. So in telegenetics, if you were in Colorado and you were looking for a telegenetic counselor, often here in Arizona as well, there aren't a lot of them out there. And to have to travel for that consultation as opposed to having testing and even cutting your trips in half is a significant difference for many people. So you can do a search based on where you are, what service you're looking for, a little bit more information about yourself, and you get this great list. So we want to make it easy to connect people to telehealth. And I always say I have the best job on the team, right, to promote telehealth and telemedicine. And we continue to do our training programs. We're doing a statewide training program in Nevada, and I can't wait. This is like back to plain old vanilla multi-point video conferencing. We have, much like Arizona, where we have some competitive health sciences networks happening in our 3 state universities, we do have, much like Nevada, much to be proud of by having multiple places, so that both UNR and Las Vegas have gorgeous health science centers. And then Carson City, of course, is the capital of Nevada. So to offer telemedicine, telehealth training to healthcare professionals in those 3 cities is pretty bonus. And we look forward to doing that in July. We do a lot of resources, and I want you to easily get connected. So I'm going to share this as a PDF after this. A little bit later, we'll share an update on telethon libraries, but here's a link to the press release for that project. More entities, including Pima County Health Department and Pima County, are deploying things like kiosks for people to take their own vitals and take charge of their own health. There are also other programs at the Health Sciences Center that are doing small grants with libraries to do things like community gardens, a lot of different projects. They also participated in our last Community Health Day. And these are the libraries that are their grant awardees. And I always share these slides when I'm out and about, because I want people to know that, you know, they can, of course, get connected to a digital navigator anytime, especially from our libraries. And I don't think that's the model we think about, but for people who go to libraries and librarians to be able to connect someone to a digital navigator from the library, you know, the possibilities go on with regards to what a great resource this is. And the fact is, more and more digital navigators and digital health navigators are being trained all the time. In Arizona, the Vitalist Foundation stepped up and trained 75 digital navigators specifically to help community health centers and others with this insurance transition. So to think about, you know, our community health centers that already have that nice list of things they do for intake. You know, they make sure you're qualified and apply for SNAP if you're qualified, or Lifeline and food bank, anything. Well, their ACP is on that list of intake. And now we also need insurance to be on that list as well. So there's so much that we're doing with people who really are stepping up and are the digital health navigators. We've been working with them here in Arizona for many years through the CHRs and the diabetes work that we did, the promotors in the South, and the breast cancer education that we did, as well as CHWs. So here in Arizona, we have the unique 3 different groups who are very different, and their educational acquisition is very different as well. You know, they are very much self-reported and have certificate programs. There are CHW1 and CHW2 certifications, and CHRs actually originated in the Indian Health Service. So I've got that link coming up. But the real game changer here in Arizona is their services are going to be billable. And I sure would love to see that branded as a digital health navigator billing code. There are other states that already have billing codes, but if we do have a CHW or CHR who has certification, they can claim, Medicare can claim reimbursement. And that's going to be a game changer for diabetes and for a lot of things happening. So there's a lot that we're doing to make this happen. And it's taken a lot of groundwork for a couple of years, but the stars are lining up, which is really great. So if you want more information about the CHRs, the CHWs, the promotoras, AZCHOW has their next conference in June, if that's something that you'd be interested in learning. And they really did group together, form a 501c3. They have a very formalized process for providing training. And I also wanted to share this beautiful new AIDEN link for information about the Arizona Digital Inclusion Network. It's been such a pleasure to network with people and have our own chapter of the National Digital Inclusion Alliance. And here you see the fun group, many of the people who went from Arizona to the conference. We really should get together and share everything that we learned. We went to kind of spread out and all ended up in complementary presentations based on our experience, and it was really a lot of fun to network. And it's great working here in Arizona with the practitioners, with the boots in the mud kind of people. And we're very fortunate here in Arizona, and I'm hoping that Mikhail will come and tell us an update, but we're very proud of the fact that we do have a tribal entity that was awarded a digital navigator tribal-led core, and that would be the Gila River Indian community. And at NDIA, as well as at ADIN last week, it's been wonderful to network with Tyler Smith, who's the digital navigator who's really built that program and built up some really amazing resources and is doing a fantastic job. And one of the things that I wanted to mention, which brought up my question, Elena, is I know that at some point, and I think Cindy might have put together this form where there's a list of preparing to apply for ACP. You know, for people who can get an email address before they go to the library, before they go to ask for help, and if they can put together this pile of documents that they need, because the horror stories that you hear of many people who do the signups is, well, we got everything together, but the proof of participation in SNAP wasn't on letterhead. Well, to try and prevent those types of things, that to be able to, as we do community health days, as we do invite people to come sign up, it's also, I want to start baiting people earlier than that with this list of the things that you need, because if they can come to a community health day and they're prepared, we can sign them up. If not, then it's like, well, I'll come back and do it later, or when I get all my stuff together, or, I think that we'd get a lot of bang for our buck, and, 1 page English, 1 page Spanish, front, back, and have that list in the order that it's asked for on the application, along with those helpful hints. If you're requesting documents, make sure that it's a qualified document that will be accepted, because we want to set people up to be successful. And Tyler's done a great job, and it's been great to meet him. The other conference that I had the opportunity to attend recently, I was so lucky, begged my way in, I might add, the National Tribal Telecom Association. There was a whole hallway of federal resources and our HRSA federal grant. I was happy to be there to sing and dance telemedicine, telehealth, knowing that I had information that I could have helped anybody with nationally. But it was also wonderful to see how represented our state was. Sandeep, of course, participated on a panel, as did Nicole Umayam. And Miguel moderated that panel. It was really amazing and made me proud. And the thing that really made me proud, which was so striking, is the best thing ever was many of the leaders in tribal telecom are women. There was a panel, and it's true. I mean, you look at this nationally, and it isn't just a matriarchal thing, it's a super smart thing. I was just so proud to see that. The other thing I wanted to do is share a quick update on telehealth in our library. So Mala and I are taking our show on the road this summer. We love to share what we've done. We've interviewed 7 or 8 different states. We still network with a monthly group of people who do telehealth in libraries, who either have a pilot or have done a pilot. There's now like 19 states or something crazy. This is more like a national movement, right? It's something that's taken a long, hard road to get there, but Mala has installed connectivity up in Navajo area where we can continue this project. And we've also started conversations with the Tohono O'odham, who have a Arizona broadband planning grant to expand to 12 locations. So again, there's that link. And then Mala and I, we really obviously want this thing to grow. And we've partnered with NAU as well as Dr. Kim Shea, who's on our team, with a cancer grant. And the next location will be in Tuba City, where we'll have this set of equipment, including a medical grade tent, and use it for training, use it for screening. And really the most important things that are next steps, of course, are to, I included this just as an FYI, but it is still really interesting to see. These are all the folks that were awarded those broadband planning grants. And it's the last one here, 12 really remote Tohono O'odham sites, which will be really great. So training digital health navigators for the future, we only have 2 pilot locations, and we really want people to go there and use this stuff. So we really need to be planning events in the library that bring people in. We can show them how to use the blood pressure cuff. We can encourage people in the local community to use these devices, because it's going to be a lot easier to expand this and invest in more the more people use it, right? Our success is measured in numbers. So I've been working with trying to get a contact with the VA so we can have people who want to eliminate pre and post surgery follow-ups or any type of appointment they want in their local library if they're in that geographic area. And that's it. 19 states now have pilot projects. So it really is a total national movement. This is a really great learning module produced by the National Library of Medicine. That's Telehealth 101 for libraries, and tells them what they need to know if this is something that they want to do, because many libraries, of course, just as ours here in Arizona, did quite a bit of research to be sure that network security was being addressed, safety, all of the things that of course you take a look at. But to have like a how-to playbook or help people learn how they can do this has really been great. And Mala and I at our presentation in July will not only be doing a 1-hour panel, but we also would be facilitating a discussion with whoever else is doing a program, whoever is interested in starting a program, and sharing all the resources and the great contacts that we've made by working on this. So one more really great resource that I have to share. First of all, I wish Cindy was here because I'm so excited for her, and congratulations to Cindy, our Digital Equity Program Manager for the Arizona Commerce Authority. And if you have not seen this, you have to go. You have to go. on the Arizona Commerce Authority webpage, and I saw this demonstrated over a year ago with the Maricopa Association of Governments. There's this Arizona asset map, and you click around and you can sort things. You can look at the mines, you can look at congressional districts, K through 12 schools, which is really amazing. So you click on hospitals and you get all the hospitals. You click on the link, and of course you get that minimal information, the address, the phone number, all that stuff. So that means that when you're traveling, no matter where you are, no matter where you live, you can click on libraries, and again, look for a specific library. You're looking for a library in this neck of the woods. Well, that would be the Tonto Basin Public Library. And again, very minimal information, and populates what you would want to know. And it's just an amazing tool. If you haven't seen it, just go fishing, just go look at it, because no matter how you slice it, it's a great resource, and hopefully it would be useful for you in something that you're working on. We also have a new American Indian Health Education Center. We've had AHEX for many years. We have the first one that's dedicated, and this is really helpful with things like our medical residency programs, where we send students out in the community. And then this link was very helpful to me. And if you were interested in contacting and working with someone who's responsible for education in any of the 22 federally recognized tribes, this is an awesome link. I'm busy planning with the Arizona Diabetes Coalition a tribal diabetes summit, we're calling it summit, November 2nd. And we really take great pride in the fact that we want to aggressively be sure that we do get representation from all of these tribes. And we do want to reach everyone. And it is going to be an opportunity for not just an update for clinicians, but patients, and the opportunity to do some digital healthcare training. And this is my favorite FCC handout, which I always share. This is the folks who know everything about data exchange for both Arizona, Colorado, and maybe even some other Western states, if that's something that you're interested in. It's a great resource, and absolutely is a very critical piece of telemedicine and telehealth and healthcare in general, is data communication between all of your different providers. And then this is the American Telemedicine Association. We have 2 former presidents on our team. We've always been very involved. The technology special interest group is always looking at the latest and greatest. The latest and greatest right now are multi-purpose devices that, do ears, eyes, nose, throat, everything, but also the database and the providers, which, it's hard to piece it apart, because of course, if you have the providers, maybe you just want the technology, and it's a different transition. But I'll be doing my annual technology review in June or July. So stay tuned if you're interested in that update. And our webinars are the gift that keeps giving. If you want to learn more about the grants that we did a great thorough presentation on in February, all those grant resources, please check it out. Information about the end of the public health emergency, information specifically for FQHCs and healthcare providers. But if you surf, you can look at this either by the word, of course, the name of the presenter, but it's a great resource. And we absolutely say always tomorrow is here, but I think honestly what might be a better saying is tomorrow is today, right? It's here right now. And I'm very excited to have the opportunity to share all these resources with you. And I am going to save it as a PDF right now and stick it in chat, because I don't know if you distribute that stuff, Steve, or you want.
I do. I was just going to tell you, please be sure and send that to me, and I will make sure that it gets included when we send out the update.
Okay.
If you put it in chat is fine, but just FYI, any files that are put in chat after the meeting's over, you can't download it. So you can download that file while the meeting's running, but you can't do it afterwards. And it's not in the chat when I send out the chat. So
Okay, well, I'll get it to you.
Yeah, so please send it to me. Okay, any questions? So Janet, I can't understand why I thought you were just sitting around with your feet up with nothing to do.
I try not to get too excited. I come back and talk about how great the food is, It's not the Bon Tour, but I'm very lucky because I get to attend some really great conferences. I really enjoyed the NTTA conference, and I had never been to an NDIA conference, which just by coincidence was next door to ATA. I was like living in San Antonio for a week and a half. It was great.
I was interested in going to NTTA, but I couldn't make it.
And then I should also mention the American Telemedicine Association is going to be in Phoenix in May. How cool is that? in a year.
Awesome.
Yeah.
Okay, anything else, Janet, or any questions or comments for Janet? Well, thank you so much, Janet. It was good to see you, and hopefully we'll get to see you a little more regularly. I know you're busy like everybody, but it's good
Thanks,
to have you
Steve.
here today. So one last thing, you didn't give us a good picture of what's happening with this fellowship thing. What does that mean?
The fellowship?
Yep.
So it's interesting. That implies that it's like, you know, a piece of work, like the fellowship that produced the digital navigator materials. But this is more of a fellowship in terms of being like a brain trust of fellows. It is people who have worked hard on behalf of the American Telemedicine Association and the network that has been developed throughout the years of telehealth to be really just to serve as an advisory board. And Joel Bartholomew is a fellow, by the way.
Haven't
So
seen
there's
him
a
in a
couple
long
of
time.
from Arizona as well.
Yep. Okay. Any questions for Janet? Going once, going twice. So Janet, I think you've pretty much covered your updates for today.
Yeah, that's great. Yeah, I got to see it all too. This is great. Thank you so much.
You bet. Okay, so I don't think, unfortunately, I guess, excuse me, that Mikhail had to drop off. We'll try and get him rescheduled. I had actually talked to him that wanted him to actually, this was going to be just a brief intro, but wanted him to really focus on the work that they've been doing, because I think it's a really unique and interesting kind of program that I think a lot of people will be interested in. And as I was talking with him and asking him about whether he's been partnering with a lot of the folks on this call, that he said, no, I don't know them, and I don't know her, and I don't know him. And so I said, hey, well, then maybe we need to get you engaged again. So possibly next week we will hear from him. The other thing is, while I'm mentioning that, is that you may know that I've been trying to schedule an update on what's happening in Indian country, and it's been quite the challenge. It's like herding cats. So hopefully that will happen sometime in the next week or two.
Everybody's just so crazy busy.
Yep. And some of us were sick, Janet.
Yeah, that too. And then there's that.
John Keller, are you still online?
I am, Steve.
So John, you want to give us any quick legislative update?
Well, thanks, Steve. I told Steve that nothing had happened. I'd be happy to come on and tell everybody nothing's happening at the legislature. They're on spring break part 2. And they have to get another Republican in the House and a Democrat in the Senate to fill out the roster. There's some budget negotiations going on. That's some of it's visible, most of it is not visible, because it's taking place between the governor, the Senate president, and the House Speaker. I heard somebody earlier on the call say that they were working with the Office for Economic Opportunity. And I wanted to point out there's a bill, and the number I don't have off the top of my head. The office is subject to sunset review, as are all state agencies from time to time. And the legislature killed the agency, killed the division of the Arizona Commerce Authority. It'll likely get resurrected in the budget deal, but it was a combination of certain Republicans who didn't like aspects of the government role, and Democrats who didn't like some of the incentives that OEO is responsible for administering. So it died 15-15 in the Senate. So like I said, it'll likely come back, but it's under a bit of a microscope at the moment. I've sent to Steve and to Mark and to Mull and others a 1-pager on the E-rate matching grant program for the recapitalization of that program that was first started in 2017. So please share that, get the word out. We got to fight to keep that in the governor's budget. That's all I've got for now, Steve. But of course, if anybody's got a question, I'll be happy to make up answers.
Okay, thanks, John. Glad you could make it for a few minutes today. Any questions for John? Apparently not. So let's move on. So Mala, you have anything, any updates that you want to share with us today?
Yes, I am totally excited by the first wave of funding that we've got from E-rate. We had 1,222 applications for Arizona schools and libraries this year. And of those, 562 of them got funded in the very first wave. This is the first time ever. So they release funding by waves every week after review. So, the reviewers have been doing really awesome work to be able to review so many applications and send us funding letters. We had totally applied for 86 million. That is, the discounted amount was 86 million. And of that, 17 million has already been approved. So libraries and schools can start their work and get their upgrades done during the summer and be ready for school reopening on from 1st of July. So can libraries, although libraries, this is a very, very busy time. Summer reading program is on, so they usually don't do their upgrades until the summer is over. But at least they know that they've got their funding and they can get all their ducks in a row and order whatever they need to order to make sure that they have the right speeds and upgrading their routers, hubs, or anything else that they need to do. 17 million in just the first week is awesome.
That's because you're awesome. That's because you're awesome, Mala.
Oh, no. I think it's because I think they're getting it right. The applicants are finally getting it right. And they are, this just shows that that there haven't been much errors in their application and they were able to go through smoothly. There are some that are caught up in the pipeline of reviews, so that they'll get funded once they get reviewed. But I think that's awesome that that we got so much within the first in the first wave itself. The other thing that is going on is that there is the tribal library support, a notice of rulemaking that FCC had put out. The deadline was April 24th, and a number of stakeholders had provided feedback to FCC. The reply comment period is now on, and reply comments are due by mid-May. I think it's the 23rd May, sorry, 23rd May. And these are in trying to make the rules and guidelines easier for tribal applications, tribal schools and tribal library applications. Some of those I think we would really benefit by having it even for the regular public libraries and schools, not just the tribal ones, cost allocation that they want for splitting allocations in the building into which the internet comes. That's crazy the way it's done, but all of that we're requesting that they simplify the process. So hopefully that will happen, and we, with all the comments coming through, they'll simplify the process. Other than that, I don't have anything, but I just was so worried about the May 9th date. May 9th is the date that three of us, at least on this call, Janet, Erin, and I are speaking at the NACOG meeting about that meeting is on transportation and health technology summit for rural healthcare, and they are doing it they're doing it downtown Phoenix. They've invited us to talk about our telehealth projects and transportation needs of the community that are being met by the libraries doing telehealth. So we're going to do a little bit of discussion on that. And that's the very same day. It had to be that very same day that we have Chairman Rosenworcel coming too.
I already reached out to Todd to see if we can get rescheduled into later in the day so that we can be at both.
Thank
Or at least
you,
some
Erin.
of us, of course.
Thank you, thank you. I was just, like I said, when he said 9th, I was hoping he would say June 9th, but it is May 9th. Anyway, it is what it is. So we'll try
Just
to split
FYI,
ourselves.
last meeting, we had a presentation from one of the folks who's helping to coordinate that conference.
Oh, yeah.
And I
Todd
did
Morris.
send out the notice in the meeting announcement today, and I will again following this meeting about information on that conference. And it's
Right.
important because it really is a good way to talk about the intersection. I mean, we all know that transportation is an issue, particularly getting people signed up for ACP, but it was really interesting, I guess, a new level for us in looking at ACP and digital inclusion issues.
Correct. And Todd Morris, we got in touch with Todd Morris only after that last meeting, Steve, just so you know that your invitees to the meetings really are people we follow up with.
Good.
Seriously and sincerely. And Erin got in touch with him, and so did I, and he got back and signed us up, and I think he got in touch with Janet as well. So all three of us, he's roped us into that to that meeting.
Right.
So
Well,
thank you, Steve, for
you guys were the people that I told him he needed to talk to.
that.
And Aaron, you're a little slow. You're probably contacting him 5 minutes after the meeting or something.
Actually, I emailed him during the meeting. Thank you very much, Steve.
Well, you're pretty amazing. So Aaron, do you have anything else that you want to share?
Just super briefly, we don't know if these program proposals would be accepted or not yet, but there are a number of digital equity and telehealth focused program proposals up for review for the Arizona Library Association's conference, which is coming up in October, which will be held at the Wipapa Casino. And so I'm only bringing that up because in case people on this call who love libraries, which we know a lot of you do, are unaware, you can actually be a member of AZLA as a library lover for only $15 a year. And then you get to participate in things like the conference and things like that at a reduced rate. And so I just wanted to let you all know that we're going to be well represented in the DE and telehealth spheres, hopefully, as long as we get accepted. And so if you're interested at all, I'm just dropping a link to the conference information. I mean, you can come to the conference whether or not you're a member, but if you want to be a member, you can do that too. I happen to serve on a committee for AZLA and have for the entirety of my time here in Arizona. So it's a wonderful organization to support. And of course, there's so much intersection here, you know, in the next few years, but always, you know, in that education and adoption and all of those aspects that we were discussing earlier. You know, libraries have been doing digital inclusion work since before that was a term, because we've been, you know, guiding people through all of that. So just wanted to give a little plug for AZLA and the conference as well. And Paul, I just dropped the links for you there in case you are interested. I know you're going to sign up before the end of the day, aren't you?
Okay,
so that's about all. Oh, that's all
Thanks,
I've got right now. If there's
Okay.
any questions, let me know.
And I don't think Holly is on the call today, is she?
No.
Okay.
No, I don't think so. Mhm.
Okay. And we've heard already from Janet. Philip, are you still online? Philip saying? Yep. Guess he's gone. And Derek's not here. Roy, you have anything else you want to add about the Final Mile project or anything? Oh, is he gone too? Okay. We'll see how you are. Just a reminder, a couple of things which you already heard about was the Healthcare and Transportation Workshop on the 9th. On the 11th, the Arizona Technology Council is having their cybersecurity summit. And on the 18th is the ASU Enterprise Trusted Learner Network Unconference, Charting the Horizon. And June the 7th is Building for Digital Equity Community Networks Institute for local self-reliance. So I don't know if I'm sure there's probably other events, but I think that's it. So anybody have anything else that they want to share or announcements? Not hearing anything. Sharika, you want to give us an update on your event?
Sure. It was great. It was hot. 17 different activity tables, 363 attendees. Yeah, it was good. Very diverse, very interactive, and Wind decided to come and take a tent, but we were able to keep, no one got hurt.
Well,
It was good.
That's always a good thing. So Lupe and Elena, do you guys have anything that you want to provide an update on the grant and what's happening at this point? I know you're kind of still figuring it all out, but anything that you want to provide an update?
On our end, we're waiting for the NOA. We did have to send up some additional items that we had to send over, but after that, we're just waiting on, but we are doing our due diligence at the same time. And for the positions that we are going to be posting, we're already working with our HR team to kind of get everything going. So when they do announce that we have the NOA, we can go ahead and get them published. And at the same time, we're kind of just sharing it around to see if there's anybody that may be interested. So that way we can kind of be a step forward and kind of have a plan already of where we're going to be starting. And the goal will start here in Arizona in the very beginning and have a calendar where we'll kind of go into our 28 counties and how we're going to implement those. But I know our programs within CPLC are very excited. And so we've been kind of keeping them engaged. So when we get that going, they're ready to go on their end as well. So we can start doing a lot of the ACP applications and getting people enrolled. And we have been working with a couple of ISP providers as well, because what we want to do is, depending on the area, we're looking at the zip code and identifying which is the best ISP, but then working with that community, because we'll be working with those program directors to say what their community they have identified for their best ISP. So that way we can bring a couple options when we're doing that enrollment. So we can enroll them and then they can go to the ISP that they would like. And then that way they're leaving with, full service ready to go. And we are currently identifying additional funding so we can provide devices for all the households that come through.
Cool. Awesome. Any questions for Lupe? If not, Elena, you want to add anything? I know you've got a contract with the city of Phoenix, I believe.
Yeah, we also will have a contract with ASU. We just found out.
Okay.
So that's exciting. The work with the city of Phoenix is going to kick off with that May 9th event. They want us to help them do ACP application labs as well as outreach. So we will be working on a new marketing, probably digital marketing and outdoor marketing campaigns around signing up and being able to call the 800 numbers, which would be the call center where they can get help, assistance in getting their applications processed. And yeah, so not much that we haven't already talked about. I mean, as far as our work on the ground, it's going to be, as I mentioned before, largely through school connections and events and working with the city, within the city's different agencies to help them not only provide navigators and some training, but also as a consultant.
Okay, any questions for Elena? So I'm going to take one more minute, and Jenny Rickle, you're online. I'm going to put you on the spot. I want to just quickly, you guys are doing some great stuff also, and maybe you want to just tell people quickly about some of the work you're doing.
Well, gosh, you are putting me on the spot, Steve. So I think you all remember that we work with the Pasco Yaqui tribe in Tucson, and they were awarded the NTIA TVCP award, was announced last August. And not to be negative, but I'm sure you're hearing the stories about all of these pots of money. They're taking a long time to flow out. So environmental assessment is a big piece, particularly when there's a lot of moving parts. So there's a fixed wireless component, there's fiber, and it's all being done on land that, of course, is going through not only TIPO, but SHPO in the state of Arizona. The good news is that at the tail end of this summer, if it tracks correctly, then that infrastructure will go in place and serve 1,372 new end users in that area. So that's exciting. That's a big number of people who really need the internet. And the other thing is, I think some of you remember that Native Network is a Microsoft Airband partner, and we got bad news recently that Miley Martinez had left the organization, but we still have a lot of people that we work with there, and we're actually having a meeting tomorrow to regroup on as it relates to digital equity and inclusion tools that Native Network and any partners can use for their customers. So probably have a more meaningful update on that front for you, Steve, here, maybe even next week or two, okay?
Yeah, I saw that Miley, I assume she was gone since her email is no longer functional, so.
Yeah,
So
so I'll
that-
let you know what happens there and see what kind of traction. I think we had a fellow not too long ago from the Teals part of Microsoft, right?
Yeah.
On this call.
Yep.
But we'll see what else we can stir up for some tools.
Yeah, because I've been wanting to get them to do a presentation, and I had talked to Miley some time ago, and then we hadn't really connected. So because we haven't really heard about Airband and what Airband is and what people are doing.
Yeah.
Jenny, do I remember correctly? I think first of all, you want to just tell people quickly who you're with?
Yeah, sorry, I did mention our name. I did that midway through, but so we are based in Washington State, but we do a lot of business with tribes all over the country. And as it relates to you guys, of course, I mentioned Pasco Yaqui, but we were formed. I'm one of the founders in 2015 to work almost exclusively on solving bridging the digital divide in Indian country, but in a way that we support tribes in being their own telecommunications companies. So we do a variety of things to help them with that.
So Jenny, again, and maybe my memory is not correct, but I thought you guys had developed some kind of a portal for either the community college and or the community, the town community. Was that you or was that somebody else?
No, I think you're thinking maybe of someone else. We do have a portal so Pasco Yaqui's ISP is named PYT Networks. And with the help of Microsoft, we have had a portal for tools and things that relate to their constituents, their members. But we are honestly out of date on that. And that's one of our meetings tomorrow is with Microsoft, how do we work together to just refresh and get the latest and greatest tools in the hands of people who need them.
Okay, thank you. So Jenny, when you find out who could be the lead with Airband, if you'd let me know, that's two people now who have left.
Yes.
So
well, I think you guys have seen in the headlines, some of these big tech companies are really, they've let go of a lot of people, and the folks that stay around, I think they are spread fairly thin. So, but I hear you. I have the same frustration.
Okay. All righty. Anything else for the good of the order? I'm going to stop the recording, and if anybody wants to stay online and kibitz for a while, fine. If not, we'll all go eat lunch or whatever.